Welcome back. In this video, I want to get us started by talking about movement terminology and terms about anatomy and relative locations of things in the body. Now, to motivate this, you might be wondering, well, how much am I really going to need this? I know I had to memorize this in structural kinesiology or anatomy, but I found that this is extremely useful to have down really, really well. Obviously, you might think that I use this all the time in my research, which is true, but even back when I was a cross-country and track coach, I would find myself using this all the time. The reason being, quite often, I would have athletes who would go to a doctor, go to a physical therapist, have an x-ray, have an MRI or a CT scan, and they would come back with results, and we would need to be able to interpret those with regards to what we were going to do with their training. So you need to be able to understand terms like inferior, superior, medial, lateral, dorsal, ventral, things like that. Quite often, you'll be confronted with these even if you didn't think you were going to end up working with medical information all the time. Even in sports performance situations, you'll be dealing with this stuff on a regular basis. Now, the reason why we have all these very particular kind of arcane, weird words is so that we can be really specific about exactly what we mean. Instead of saying, oh, I have pain on top of my knee or underneath my foot or behind my knee on the front of my shin, being able to be really specific about where we're talking about on the body or how things are moving relative to each other on the body is extremely important. So that should motivate why we need to know this stuff really, really well. And now let's just jump in and start taking a look at what we need to know. So I've got a skeleton right here, and the first thing you might notice about this skeleton is that it is in what we call the anatomic position. Now, this, for most of the body, this means just kind of standing up normal, but the one thing you'll notice about the anatomic position versus how you might normally stand is that these hands are rotated outwards, thumb facing out like this. So you'll quite often hear me or read in scientific articles or things like that talking about things relative to the anatomic position, and that's what we mean. We mean like standing like this. So let's review, or perhaps if you haven't or don't remember this stuff, this will be for the first time. Let's talk about things in the body and where they are relative to one another. The first thing that we need to think about is the difference between anterior and posterior. So, anterior, posterior. Anterior means, and I'll try and do my best to draw in 3 dimensions in 2D here, on the front side of the body, so towards the stomach like this. Posterior means on the back side of the body. You might be familiar with these bony landmarks. There's one right here, and maybe while I'm filling this in, you can recall what that's called. This is, and maybe I can give you a hint, it's ASIS. That stands for anterior, superior, which we'll talk about in a moment, iliac spine. So it's this little bony thing right here. There's another one. This is technically the left anterior superior iliac spine. And the right one, of course, is over here. By the way, I should note, this is the most basic thing possible. But when we're talking about left and right, we mean the let's call it the patient. It's the patient. Left and right. So the left anterior superior iliac spine, right there on the person's left side of their body. So it's anterior because it's on the front side of the body. And you might guess, and you'd be correct, that there's one back here, kind of at the bottom of the lower back, which is called the PSIS for posterior superior iliac spine. So anterior, that's like the front. Posterior, that's like the back. The little mnemonic that I always use here to remember this is posterior is like posture, and having good posture means keeping your back straight. One confusing thing that we'll run into occasionally is that different fields of science and medicine use slightly different terms, and this is one of those cases. This is generally in like medical literature. You'll see anterior referred to as the ventral side, and posterior referred to as the dorsal side. Now, the way I remember this is that dorsal fin is what you see on like a shark. So then you've got a shark like this, maybe. Doing my best shark artwork here. They have a dorsal fin on their back, right? And that's what you see above the water when you're swimming, or hopefully that you don't see. So dorsal, that's the back. Again, you'll probably see this mostly in medical stuff. In more kind of sports performance, sports medicine, you'll usually see anterior, posterior. Okay, anterior, posterior, that's one. Now, let's talk about medial and lateral. I think you know what these are, but medial, that's like towards the middle of the body. So medial, it's kind of moving towards the center line of the body, if there's like a center line that goes down like this. And then lateral, that's like moving away from the midline of the body. You might be familiar with the medial and lateral malleolus. So medial malleolus, or malleoli, the plural term, medial, hopefully I spelled that right, that's like that part of the ankle and that part of the ankle. Now notice they're both on the inside towards the middle. And then, as you might guess, there is also a lateral malleolus. Can never remember if that has one or two L's. That's there and right there. So medial and lateral. Medial, of course, you can remember it's like towards the middle of the body. Lateral is like towards the outside of the body. Another set of terms that you'll need to know are distal and proximal. So distal, proximal. These are also relative terms, and they mean towards and away from the center of the body. So distal is like towards the center, meaning, let's see. The distal part of the femur is, I might have said that wrong. Distal means away from the center. So the distal part of the femur is like down here. The proximal part is up here. And that's, okay, so let's say the center of the body is maybe at this big X right here. I'm mostly familiar with lower body, so it's less confusing for me. But let's say we're talking about the humerus up here. This is where it gets a little confusing. The distal part of the humerus, meaning the further away, you can think of dist as like distance. It's further away from the center of the body, which means you kind of got to like track the skeleton. So the distal part of the humerus is out here, and the proximal part of the humerus is back up here. Because it's closer, prox as in proximity. It's closer to the center of the body. So, distal and proximal. We've got a few more. One being superficial and deep. So maybe it will be, I'll explain it on the skeleton first. So these are they're at least intuitive with the normal English words, English meaning. So we've got superficial and deep. And these mean superficial is like towards the outside, like towards the skin, wherever your skin is. And deep means sort of like inside. Oops. So this is like outside, sort of outside. We'll colloquially say outside. And I'll show you what I mean in a minute. Deep is kind of like further in. So let's say we're taking like a kind of a cross-sectional slice of the femur or the knee joint like this. If we could do that and look at it on let's say some medical imaging, it would look like this. This, by the way, here's the kneecap to try and orient yourself. Here is the most, let's use the vocabulary we just learned. This is the most distal part of the femur in here. So if we're talking about superficial and deep, superficial and then deep. In your notes, maybe you just draw a little sketch of this. Maybe you just kind of like maybe label it kneecap or patella, and then there, distal femur. Don't need to be super precise when you're drawing, and of course, the skin is out here. Superficial means like here. Maybe you might see in a medical report somebody has superficial hamstring pain. That would be like kind of pain in this area. Deep hamstring pain would be, that's like further in, right? It's further in towards the center of whatever it is we're talking about. If we're talking about maybe the front side of the knee, superficial would be like out here. Deep would be, further in here, closer to that center point. So that's superficial and deep. One more set you'll often see is inferior and superior. Let me write that down. Inferior and superior. Inferior means like further down, kind of further down the skeleton, and superior means kind of like further up. So we actually saw this already. There is something right here called the anterior superior iliac spine. There's actually something, it's less commonly talked about because it's less prominent, but there is actually a such thing as an anterior inferior iliac spine. It's down here somewhere. So the superior one is further up. The inferior one is further down. So inferior, superior, these are also pretty straightforward. Now, there's one more term that you might encounter, or one more kind of pair of words, and that is greater and lesser. And unlike everything we've talked about, these are kind of more vague. Usually this means there is a pair of things, one of which is bigger or more prominent than the other. You're probably or hopefully familiar with the greater trochanter, which is that bony prominence right there. There is a such thing as the lesser trochanter, which is down here. So greater is the bigger one and lesser is the smaller one. That is not too common. There's only, I think, a few things in the body that have used that terminology, but I wanted to outline it because you might run into it. So just to review, let me write down again all of the terms that we learned as a sort of like a pair. So we learned about anterior and posterior, as well as their maybe more medical terminology, ventral and dorsal. We learned about medial and lateral. Medial, that's towards the middle, lateral, towards the outside. We learned about distal and proximal. Distal meaning further away from the center of the body. Proximal meaning closer to the center of the body. We learned about superficial and deep. Superficial being close to the surface, deep being further in. We learned about inferior and superior. Inferior meaning like further down towards the bottom, towards the ground. And superior meaning above, on top of, right? Super, that's what that means. Superior. And then lastly, we learned about greater and lesser. And just wanted to make sure you've seen these and you're not wondering about them. These don't really have usually this means like there's a bigger version of something and a smaller version of something. Greater and lesser trochanter are probably the best example of that. So hopefully you found this little terminology guide useful. We'll be using these terms all the time in this class. Now, in the next video, I want to talk about the three fundamental planes of motion for the body.